Good evening, everyone. Thank you for attending the webinar. My name is Dr. Joseph Debay. I'm a chiropractor, board-certified nutritionist. I practice in Great Neck, New York, and I consult with people long distance. Our topic this evening is a functional medicine approach to treating depression. I'm a little bit rusty with webinars. Haven't done any since last February. That one didn't go very well. I had a very old computer at the time, so I apologize if there are any glitches tonight. Why are we doing a webinar on the functional medicine approach to depression? I think there's a lot that people need to know that they're not getting from conventional medicine. The way conventional medicine approaches depression is as if it's simply caused by a chemical imbalance in the brain, and the solution is a synthetic chemical to rebalance things. Now, let me say at the outset that I don't feel I have all the answers for depression. I'm going to focus on, obviously, what I know, and I go at things from a biochemical perspective. I think there's a lot of value in psychological approaches, best done by a qualified licensed psychotherapist. And I think medication plays its role as well. Medication does people some good, but there's a lot more to look into. And oftentimes trying to use synthetic foreign chemicals that didn't exist a few years ago to create wellness just doesn't work. Now, is diet and lifestyle nutritional supplements alternative medicine? I feel it's not alternative. I feel it's, in most cases, the best medicine. And here's a study from the British Journal of Psychiatry. Dietary pattern and depressive symptoms in middle age. Analyses were carried on data from 3,486 participants in which two dietary patterns were identified: whole food, heavily loaded by vegetables, fruits, and fish, and processed food, heavily loaded by sweetened desserts, fried food, processed meat, refined grains, and high-fat dairy products. Self-reported depression was assessed 5 years later. Conclusions. What they found: in middle-aged participants, a processed food dietary pattern is a risk factor for depression 5 years later, whereas a whole food pattern is protective. So hopefully you've learned something already. When it comes to your mood, you have to pay attention to the quality of your diet. May seem obvious, but I don't know if most doctors who deal with depressed patients are really stressing this fact. You want to be eating real food, whole, unprocessed, nutrient-dense food. Dehydration in women was found in the study to have an adverse effect on mood. Just a small amount of dehydration can adversely affect your mood. Adherence to the Mediterranean diet is associated with better mental and physical health. The first newsletter I wrote, which you can access from my website, by the way, I entitled The Longevity Diet, and it was about all the research that's been done on the Mediterranean-style diet. And Mediterranean-style diet has been associated with better mood. This is the type of diet I work with my patients. Okay, now we're going to talk about activity. Type 2 diabetes, cardiovascular diseases, colon cancer, breast cancer, dementia, and depression constitute a cluster of diseases which defines a disease zone of physical inactivity. Evidence suggests that the protective effect of exercise may to some extent be ascribed to the anti-inflammatory effect of regular exercise. Exercise is good for mood in general. It's good for your health in so many ways. Vigorous exercise, in particular, has an anti-inflammatory effect in the body. And we're going to see later on that inflammation is one of the contributing factors to at least some cases of depression. Here's a study that talks about the influence of exercise on a biochemical called brain-derived neurotrophic factor. More recent research in rodents and humans has shown that exercise promotes the production of a beneficial substance called brain-derived neurotrophic factor, or BDNF. BDNF appears to cause antidepressant effects. I call exercise miracle grow for the brain, says this author. Exercise keeps these cells healthy in a way that even playing chess and other highly cognitive activities does not. Exercise is good for your health in so many ways, and good for your mood in many different ways. And I just want to show you the title of a study, another study related to BDNF. No exercise-induced increase in serum BDNF after cycling near a major traffic road. So pollution may negate the BDNF boosting activity of exercise. So it's not good to jog or cycle in polluted air if you can avoid it. Patients sometimes ask me, what do you have for depression? They're trained by conventional medicine and society to believe that health is created by a remedy for whatever ails them. So if you're feeling depressed, you take a pill to get rid of it. What do you have for depression? St. John's wort. That's an effective therapy. SAMI, that's another one. Or 5-HTP. These are all natural substances with research in helping depression. And I think there's some value in using them. But I don't use too much of them myself. I like to get to underlying causes. Your body doesn't have a need for St. John's wort. Your body does have a need for SAMI. Your body makes SAMI, S-adenosylmethionine. Your body does make 5-HTP. Supplementing those things is reasonable in some cases. Why not just take a medication? I think there's a couple of reasons for that. One reason is that it doesn't solve the problem. You're not depressed because you're lacking a medication. And then there's side effects. This is a paper that was published this past April. I'm going to show you a couple of disturbing quotes from this paper. In fact, antidepressants cause neuronal damage and mature neurons, that's brain cells basically, to revert to an immature state, both of which may explain why antidepressants also cause neurons to undergo apoptosis, programmed death. Antidepressants can also cause developmental problems. They have adverse effects on sexual and romantic life, and they increase the risk of hyponatremia, low sodium in the blood plasma, bleeding, stroke, and death in the elderly. Our review supports the conclusion that antidepressants generally do more harm than good by disrupting a number of adaptive processes regulated by serotonin. Sobering, isn't it? Why not just take a natural alternative? Again, we're not getting to underlying causes. Let me talk to you a little bit about vitamin D to try and explain this. When someone has a vitamin D deficiency that's very significant, a condition called rickets appears in childhood. But rickets is not the only thing that a vitamin D deficiency causes. Some of the other things it causes take time. There are long latency deficiency diseases, conditions that result after long periods, up to decades, of inadequate nutrient intake. These effects of nutritional inadequacy are very common, as opposed to the classical deficiency diseases like rickets. Vitamin D insufficiency and its adverse consequences are epidemic. The next slide is going to show just a few of the dozens of conditions that have been associated with vitamin D deficiency. So over the course of a lifetime, vitamin D deficiency may contribute to infections, joint and muscle pain, ADHD, anxiety, depression, diabetes, heart disease, cancer, Alzheimer's disease, premature death. So let's say your depression is successfully treated by St. John's wort, but your depression was a result of a vitamin D deficiency, and you don't address the cause, then you're going to wind up possibly developing one or more of these conditions because the underlying cause of the depression wasn't dealt with. So the way things work in the body, there's not just a one-to-one linear relationship. There's not a single cause for a given condition. And having any given biochemical abnormality can have multiple effects. So if your depression is due to vitamin D deficiency, and you correct that vitamin D deficiency, maybe you're also protecting yourself against heart disease and cancers and Alzheimer's disease. And here's one study about the connection between blood vitamin D levels and depression. These represent nerve cells. And when it comes to conventional medicine's approach to depression, it mostly involves using a medication to manipulate levels of neurotransmitters. Serotonin, maybe norepinephrine, or some other neurotransmitters. So one brain cell produces serotonin, and it's sent across this little gap called the synapse to the neighboring nerve cell. It attaches to the neighboring nerve or brain cell, sends a message of good mood. So with adequate serotonin, you have a healthy mood. The selective serotonin reuptake inhibitors, medications that are very commonly prescribed for depression, keep the serotonin in the synapse, in the space between the nerve cells. Keeps the serotonin where it's active. So effectively it increases the level of serotonin. But they do nothing to build serotonin. And over time, the serotonin can become depleted. When it stays in the synapse longer, it also winds up being excreted from the body at an increased rate rather than being taken back up into this sending nerve cell. Where does serotonin come from in the first place? It doesn't come from medication. Your body makes it. Your body makes it from an amino acid called tryptophan. Tryptophan is found in protein foods. People usually think of turkey as a source of tryptophan. It's found in many different proteins. You have to get it from the diet. Your body can't make tryptophan. If you're not eating protein, you're not getting tryptophan. And there's other reasons why you can be low in tryptophan as well. Now, for the tryptophan to become serotonin requires a couple of biochemical reactions, and these reactions need various nutrients in order to work. Tryptophan gets converted to 5-HTP, which goes on to become serotonin. For the tryptophan to be converted to 5-HTP, you need vitamin C, vitamin B3, folic acid, iron, and your body's blood sugar regulating hormone insulin has to be working properly in order to get tryptophan into your brain. And for the 5-HTP to become serotonin, you need vitamin B6 and riboflavin and magnesium. Something called biopterin is also involved in the production of serotonin. There may be some other factors as well. So this is a list of some of the things I've come up with that may result in impaired serotonin formation and function. Deficiencies of those nutrients: tryptophan, riboflavin, vitamin B2, vitamin B3, B6, folic acid, magnesium, iron, and DHA. You need DHA in the nerve cell, in the brain cell, in order for the serotonin signal to be received. Excess levels of branched-chain amino acids can interfere. Insulin resistance, if your body's blood sugar regulating hormone insulin is not working properly. If you're eating a diet that contains all these nutrients but you have maldigestion, that could wind up impairing your serotonin metabolism. If you have intestinal bacterial overgrowth, that can deplete some of these nutrients. Toxicity, heavy metals can interfere with serotonin metabolism. Stress, the stress hormone cortisol, impairs serotonin metabolism at a number of steps. And inflammation, overactivity of the immune system. Brain structure, the structure of the brain nerve cells, plays a role in mood. These are a few of the biochemicals you need in adequate concentration in your brain cells in order to have a healthy mood. DHA, that's one of the omega-3 fatty acids you find in fish oil, cold water fish. You find it in algae oil. You find some in eggs, egg yolks. Phosphatidylserine, and the dreaded cholesterol. Fish consumption and depression. Here's one of many studies we could take a look at when it comes to fish and fish oil and depression. In Germany, they average less than 25 pounds of fish consumption per year, and they have 5.7% incidence of depression. In Japan, they eat more than 140 pounds of fish a year, and there's only 0.2% of the population that suffers from depression. It's not cause and effect, but it's interesting. In Japan, they get a lot more of the omega-3 fatty acids, which protect against depression. There is plenty of research to support that. Cholesterol is something that most people fear. Cholesterol was not created to kill us. Cholesterol is essential for life. Cholesterol is a part of every cell membrane. The cell is the unit structure of tissue in the body. The membrane surrounds the cell. If you think of the cell like an orange, the membrane is like the peel. And the membrane has to be working properly in order for serotonin and other neurotransmitters and biochemicals to have their effect. If your cholesterol is too low, there are ill health effects associated with that. Cholesterol is a building block for steroid hormones. It goes into producing bile acids, which play a role in fat digestion and detoxification. Cholesterol is a building block for vitamin D. If your cholesterol is below 160, there's increased risk of all these conditions, including depression. I actually have a cholesterol supplement in my office, and sometimes I have people take a cholesterol supplement. If they're low in cholesterol and they don't like eggs, or they have an allergy to eggs, egg yolks, then I have them use a cholesterol supplement to boost their cholesterol. And the lower your cholesterol, the more of a problem is. If your cholesterol is 155, it may not be a big deal. If your cholesterol is 120, that's a little more significant. Dietary fat is very important when it comes to your mood. Here's a study about dietary fat intake and the risk of depression. A detrimental relationship was found between trans fatty acid intake and depression risk, whereas weak inverse associations were found for monounsaturated fatty acids, polyunsaturated fatty acids, and olive oil. These findings suggest that cardiovascular disease and depression may share some common nutritional determinants related to subtypes of fat intake. Trans fatty acids you find in the hydrogenated oils, which are components of all the convenience foods. So I tell all my patients, read labels on foods. Anything you buy that has multiple ingredients, processed food, you want to avoid anything with partially hydrogenated oils. Now, a holistic approach to depression needs to look beyond the brain. The brain doesn't function in a vacuum. Does anyone in attendance have any of these conditions in addition to depression? Fatigue, pain, gas, flatulence, bloating, constipation, diarrhea, low body temperature, diabetes, high triglycerides, low HDL, hypertension, poor memory. There are different causes for depression in different people. If you have depression and fatigue, that could be from many things. Maybe it's from altered adrenal stress hormone levels. If you have depression and pain, maybe your depression is due to inflammation. If you have depression plus these gastrointestinal symptoms, gas, flatulence, bloating, constipation, diarrhea, maybe you have bacterial overgrowth in the small intestine contributing to your depression. If you have low body temperature, in addition to depression, maybe you have an underactive thyroid that's causing your depression. If you have diabetes, high triglycerides, low HDL, hypertension, in addition to depression, maybe it's insulin resistance that's driving the depression. If you have poor memory and depression, maybe it's related to low levels of DHA. Skin rashes. If you have skin rashes and depression, maybe you have a food allergy that's contributing to your depression. And these are just a few. examples I came up with, the many different combinations we can think of. Organs actually talk to each other. The functioning of your brain is influenced by hormones from your bone, by what's going on in your stomach, and so forth. All the organs in the body interact with each other. And your mood can be influenced by having problems in organs in other parts of the body. A person's diagnosis, their signs and symptoms, are like the tip of an iceberg. What's causing the depression? What's below the surface? Conventional medicine often doesn't even consider this, in my experience. In general terms, what's causing the depression is altered physiology. Things aren't working properly. And that's the result of genetic predisposition interacting with factors we have some control over. Toxicity. Anything that builds up in the body beyond a certain concentration becomes toxic. Environmental chemicals, from air, food, and water, all kinds of conveniences of modern life, Teflon on non-stick pans, fluoride in Armor All, many different sources of environmental chemicals. The body's own hormones can become toxic at some level, and other biochemicals are toxic at some level. Mercury from silver fillings in the teeth are a source of toxicity for some people. Waste products from the bacteria that live in the intestinal tract can be a source of toxicity. Medications can have a toxic effect. Stress, for some people, this is the biggest factor. Food allergy. There's different ways we can react to food. Some are inherited, some of them are acquired. Nutrient deficiencies. We all have unique nutritional needs because of genetics and other factors, and if those needs aren't being met, that may contribute to depression. And many different types of hormone imbalance. I commonly test my patients for insulin and thyroid hormones, and often I'll also check for stress hormones and sex hormones. Conventional medicine mostly deals with the tip of the iceberg with their assessment. The type of testing I do is called functional medicine testing, where we look at the underlying causes. Are bad genes a death sentence? Now, if someone has a family history of depression, it's not that there's a depression gene, but there may be a gene that's encoding for altered metabolism of the active form of folic acid, which is very common, and that can impair the person's methylation ability, reducing their SAMe levels, contributing to depression. Genes are important, but what's more important is diet, lifestyle, and environment. Genes account for maybe 25% of our state of health. We have control over most of it, whether we think about it or not. Genes are the blueprint for our health. The genes have the blueprint for all the biochemicals the body can make that make up our structure and the enzymes and hormones that run our metabolism. Every cell in the body has the same genes as every other cell. So what makes your liver cell different than your brain cell, different than your heart cell? Certain genes are active, other genes are silent. Now when it comes to health and disease, the genes that are important are inducible. They're switched on or switched off depending upon what they're exposed to. Put it simply, we have blueprints for health and blueprints for disease. And we want to live in a way that's going to allow us to access the health-promoting genes and silence the disease and dysfunction-promoting genes. These are some negative influences that turn on those unhealthy genes, so to speak. Nutrient insufficiency, not getting enough nutrients for your body to work properly. Toxic overload, stress, insufficient rest, inadequate exercise, and then internal states, chronic inflammation, which is overactivity of the immune system, neuroendocrine or hormone imbalance. These things activate genes that encode for biochemicals that change your functioning and your structure in a way that you experience unpleasant signs and symptoms, eventually a diagnosis. So all kinds of chronic unwellness are the result of genetic predisposition interacting with your diet, lifestyle, and environment. So I like to know as much as I can about these different factors so I can personalize a program to try and produce optimal results. And I learned about these different areas through consultation, questionnaires, laboratory tests, some examination procedures. And then we create a personalized program to improve the genetic expression, improve the biochemistry and metabolism, and the person's going to feel better, and we're going to be able to objectively measure that as well. And again, this is how I get the information to personalize those. Okay, these are some of the important mechanisms of disease. These are things that contribute to most chronic and amorphous degenerative diseases, in my opinion. So we're going to talk about a few of these in detail. Nutrient insufficiency as applied to depression. The role of nutrient insufficiencies. Depression may result from vitamin B1 deficiency, vitamin B3 deficiency, vitamin B6 deficiency, folic acid deficiency, vitamin B12 deficiency, vitamin D deficiency, vitamin E deficiency. I have to add vitamin C deficiency to that list. Chromium deficiency, iodine deficiency, iron deficiency, magnesium deficiency, selenium deficiency, zinc deficiency, EPA-DHA deficiency, GLA deficiency, isoleucine deficiency, now we're into amino acids, leucine deficiency, phenylalanine deficiency, tryptophan deficiency, tyrosine deficiency, and aspartic acid deficiency. So if you're depressed and you haven't been tested for all of those nutrients, you haven't ruled that an important cause of depression. To me, it doesn't make sense to jump into use of a medication without looking at these underlying causes. And with a good comprehensive nutritional test or a couple of tests, we can look into these nutrients. Any laboratory can test the iron. We can test a few of these nutrients with any laboratory. Some of the other nutrients, we need some specialized labs. I like to use Metametrics Laboratory and do something called an individualized optimal nutrition profile, which measures hundreds of biochemicals, including those. Okay, I just have a title to show you here. Dietary electrolytes are related to mood. Okay, nutrient requirements are individual, and so are intolerance to foods and chemicals. Excuse me. I've had some individuals with food sensitivities causing their depression. Individualized optimal nutrition, that's the name of most comprehensive nutritional metabolic test I know of. It's actually a panel of about 8 different tests put together into a discounted package. First part of the test is an amino acid analysis. Now we can measure 20 or 40 amino acids from blood. It shows a 20 amino acid profile. Of course, with 40, we're likely to learn some useful things we don't get with the 20. 20, both tests would include what we're seeing here. These are the essential amino acids, the ones your body can't make. You have to get these from your diet. The rest of these your body can make, but it doesn't always make enough. These are the individuals levels. This is the reference range. Then we see things left to right, low to high. Green is normal. So these are low on this individual. Quite a few normal, but about half are low. None of them are high. Often when they're high, it's due to another nutrient deficiency or due to insulin resistance. This person was low in quite a few essential amino acids, including tryptophan, which goes into making serotonin. And serotonin is the single most identified biochemical with depression. Serotonin is a feel-good neurotransmitter. It's made from tryptophan. Tyrosine is a precursor to some of the other brain chemicals, epinephrine, norepinephrine, and dopamine. And We have a measure of tyrosine in this test. This person was low in that one as well. Taurine is another neurotransmitter. Glutamic acid is a neurotransmitter. Deficiency of some of these branched-chain amino acids are associated with depression. So is the aspartic acid. So we learn a lot with amino acids when it relates to mood. When I see so many amino acids low, it tells me either the person's not eating enough protein or they have a problem with digestion and absorption. This person was actually taking Prilosec for years. Prilosec is in a class of medications commonly prescribed, shuts off the stomach acid, and it's commonly prescribed for reflux. And it can impair your digestion and absorption of a number of nutrients. And I think that this person's use of Prilosec was impairing her amino acid status. Here's a study. Add-on therapy with an individualized preparation consisting of 3 amino acids for patients with a major depression. This study was done on patients who had depression who were taking antidepressant medication and were still depressed. They did the test of amino acids like I just showed you, and based on the results, they had a custom-made amino acid powder that was geared towards correcting their deficiencies. And when the people took this custom-made amino acid powder, their depression improved. The custom-made powder is something I often have made for my patients. When I test a patient and they're low in multiple amino acids, a good approach is to get a custom-made powder to correct their deficiencies. Here we talk a little bit about toxicity. Pamela was a patient who had been eating a lot of fish. She was depressed, and she wondered if mercury might be a factor. And I sent her to a local lab. We did a blood mercury, for what that's worth. Blood mercury shows you pretty recent exposure. And her level was quite high. It was 33. Normal is less than 10. Then we did another test to confirm that she really had a major problem with mercury. We did a test called the porphyrins profile. Porphyrins are biochemicals the body makes, and certain porphyrins will elevate from mercury toxicity, and she did have signs of mercury toxicity. The precoproporphyrin is strongly, that's one that's strongly connected with the mercury toxicity. Some people have a given level of mercury in blood or urine, and the body may or may not be able to handle that okay. In her case, it was a problem. So we had her stop eating fish, and we put her on supplements to help get the mercury out of the body. I do a test in the office that gives us a functional analysis of toxicity. It's called the functional acuity contrast test. When toxins are affecting the nervous system, like the brain, the optic nerve can be affected, and it can influence your ability to see shades of gray. And there's been studies finding a connection between people failing this test and exposure to many different types of toxins, including heavy metals. And Pamela's follow-up test after we put her on a program showed mercury down into normal range. Okay, now we talk about insulin resistance and glycation, high blood sugar basically. On the left we have healthy blood sugar and insulin metabolism. On the right, unhealthy blood sugar and insulin metabolism. This represents a healthy diet. This is the intestinal tract where food is digested, the pancreas that secretes insulin, which helps to get sugar into the cell. This is a cross-section of a cell. Cells are microscopic. Think of this like a muscle cell. This is the cell membrane. And for the sugar molecules to be transported into the muscle cell to be used for energy, insulin has to attach to receptors on the cell membrane. This is the mitochondria where most of the body's energy is produced. That plays a role in depression when it's not working well. This is the nucleus where you find the DNA, the genetic blueprint. When we eat food, it's digested in the intestinal tract. Sugar or glucose is absorbed. That causes your pancreas to secrete insulin, which attaches to a receptor on the cell membrane, sends a signal into the cell. That helps to get the sugar or glucose into the cell to be burned for energy. There's a lot of things that have to be working properly for all that to happen. You need a lot of different nutrients. You have to have the right composition of fatty acids in the cell membrane. Different hormones influence this process. A lot of things can cause it to go awry. On the right side, we have unhealthy blood sugar and insulin metabolism. See how these insulin receptors look different than these? This represents what's called insulin resistance. Probably about half of Americans have some degree of insulin resistance. Insulin resistance contributes to all the degenerative diseases, and I'm showing you tonight because it contributes to depression. So with a given level of insulin, this cell is not going to get the same effect. The insulin does not work as well with insulin resistance. And there's a number of things that contribute to insulin resistance, including not having the right fatty acids in the cell membrane. If you eat a diet that's high in sugar, over time that's going to contribute to insulin resistance. High in sugar or starch. Starches are just chains of sugar. If you have a lot of sugar coming into your bloodstream all at once, your body needs to make a lot of insulin. If the insulin receptors don't work well, the sugar doesn't get transported efficiently. Your body is initially able to overcome this by producing more insulin, but at a cost. There are side effects of having high insulin. And over time, this process begins to fail and blood sugar starts to accumulate, and if it goes on far enough, then you become diabetic. Then your sugar goes into a range that's called diabetes. You could have a problem with the insulin receptors. Inflammation can impair the enzymes that send the signal into the cell, and these are some of the end results if you have insulin resistance, including depression. Should depressive syndromes be reclassified as metabolic syndrome type 2? Metabolic syndrome is related to insulin resistance. Association between metabolic syndrome and depressive symptoms in middle-aged adults. Insulin resistance contributes to depression. Metabolic syndrome is diagnosed when people have 3 or more of these conditions. Elevated waist circumference, 35 inches in women, 40 inches in men. Elevated triglycerides, greater than 150. Decreased HDL, below 40 in men and 50 in women, I believe. Elevated blood pressure, greater than 130 over 85. Elevated blood sugar, greater than 100. If you have 3 out of those 5, you qualify for a diagnosis of metabolic syndrome. If you don't have 3, if you have 2.5, you probably still have metabolic syndrome. You still have the same process going on with insulin resistance. Oxidative stress, that's another term for free radical damage. Hopefully all of you have heard of that. I'll try to explain that a little bit. Oxidative stress and mitochondrial dysfunction often go hand in hand. I'm going to explain this a little bit in just a minute. Beyond the serotonin hypothesis, so everybody gets hung up on serotonin as being the factor in depression. Beyond the serotonin hypothesis, mitochondria, inflammation, and neurodegeneration in major depression and affective spectrum disorders. Increased 8-hydroxy-2-deoxyribonucleic, a marker of oxidative damage to DNA in major depression and myalgic encephalitis, chronic fatigue syndrome. 8-hydroxy-deoxyribonucleic, abbreviated 8-OHDG. That's an indication of free radical damage to the DNA. That's something I measure on the individualized optimal nutrition profile, and that's been associated with depression. This represents a mitochondria inside a cell. Most cells have many of these little structures. This is where 95% of your energy is produced. Food and oxygen get combined through a series of chemical reactions in the mitochondria to produce energy. Food gets transported into the mitochondria, where blood cells deliver oxygen to the cells. And there's a series of chemical reactions, and energy is produced. And we saw a couple of studies ago a mention of mitochondria being factors in depression. If the mitochondria aren't working well, then you can wind up with depression. And I'm going to show you the link with the oxidative stress in a second. And these are some of the things that can impair your mitochondrial function. Not eating enough, I should have that on the list, but just not eating enough, not getting the raw material, the sugars and amino acids and fatty acids. Then we have nutrient deficiencies like carnitine, which is made from lysine, an amino acid, by the way. Other nutrient deficiencies, including iron, zinc, vitamin B6, and biotin. High sugar diet, toxicity, hormone imbalance, inflammation, low oxygen levels. These are some of the things that can impair energy production in the mitochondria. And that's not good for your mood, to have impaired energy production. Of course, you're likely to have fatigue as well. And when you have impaired mitochondrial function, you have more free radicals produced. Free radicals are always produced by mitochondria, but when their functioning is inefficient, you get more free radicals produced. And we saw that other study that talked about a connection with free radical damage to DNA and depression. So you want to correct those underlying causes where they're identified. And they can be identified with a thorough workup. To increase mitochondrial number and function, we want to correct those underlying causes and use exercise, caloric restriction as consideration, extra virgin olive oil, soy, acetyl-L-carnitine, arginine, nicotinamide, biotin, optimal T3, thyroid hormone levels, alpha-lipoic acid, coenzyme Q10, NAC, D-ribose, creatine, magnesium, B-complex. These are all possibilities. I don't suggest people use all of these in every case. We have to personalize the approach. We can actually increase mitochondria number, or at least size, and mitochondrial activity for sure. I wrote a book on one of those energy nutrients, creatine. Creatine is a critical energy substance. It's most known for muscle building and strength, but creatine is used by the brain and in other tissues as well. And if there's more creatine in the brain cells function better. They're more resilient to stresses. They are better at working memory, improved IQ, improved mood. Creatine monohydrate in resistant depression, a preliminary study. This small preliminary open study of creatine monohydrate suggests a beneficial effect of creatine augmentation in unipolar depression, but possible precipitation of a manic switch in bipolar depression. So bipolar patients need to be careful. And here's another study where people are made to be sleep deprived. One group of people got creatine, the other didn't. The individuals who received creatine supplements had better mood. Better mood and mental functioning, actually. And here's one more study. This preliminary open study of creatine monohydrate demonstrates a modest beneficial effect of this drug on sleep, depressive, and post-traumatic stress disorder symptomatology in treatment-resistant post-traumatic stress disorder patients. Here they call creatine a drug. And creatine is really an amino acid. It's something your body produces, and it's found in meat and fish. The brain needs energy, lots of energy. The brain accounts for about 2% of your body weight, but uses about 18 to 30% of consumed glucose. Energy production is critical to brain health and to good mood. This is a graph of a carbohydrate challenge test result. So these are blood sugar levels, and this is time. And the way this works is the patient goes to the laboratory fasting, gets a blood sample taken, their blood sugar is measured. Then they eat a high carbohydrate meal, and over the next 2 hours, 3 hours, they have more blood sugar measurements done. Ideally, we measure insulin at the same time. The black line shows the upper limit of normal, and there's many different types of abnormalities we can see on this type of test. One abnormality that might impair your mood is a reactive hypoglycemia. If your blood sugar drops too low, or drops too quickly, that can impair your mood. And we can pick that up with this test. And of course there are natural approaches to help correct that. When we eat, our blood sugar goes up. That causes your body to release insulin. The insulin helps to transport the sugar into the cell. When the blood sugar drops, other hormones are secreted to pick it back up. Glucagon, cortisol, and epinephrine are a few of these. Cortisol and epinephrine are stress hormones. Swings in your blood sugar are stressful. Your body has the same response to swings in blood sugar as it does to mental emotional stress. And if you have elevated cortisol, especially at nighttime, that's associated with increased incidence of depression. Okay, we're going to skip down to discussion of chronic inflammation. We saw this one before, the connection between exercise and its anti-inflammatory effect and reduced incidence of depression. Okay, now we're going to talk about beneficial effects of medication on depression. I'm not talking about selective serotonin reuptake inhibitors. Surprisingly, we're talking about an anti-inflammatory medication. So let me go back. The cyclooxygenase 2 inhibitor, celecoxib, has therapeutic effects in major depression. Results of a double-blind, randomized, placebo-controlled add-on pilot study to reboxetine. Celecoxib, I forget which medication that is. Might be Celebrex. I get those mixed up. It's one of the newer anti-inflammatory medications. People commonly use that for joint pain, and that's been found to have an antidepressant effect. Inflammation plays a role in depression. The way those medications work is they reduce levels of a pro-inflammatory chemical in the body, which is made from arachidonic acid. Arachidonic acid is found in the diet in animal fat and shellfish. So if you're eating a lot of animal fat and shellfish, you're likely to make more of these pro-inflammatory chemicals, which may contribute to depression. See, the fish oil is anti-inflammatory. DGLA, which you get from other plant sources, is anti-inflammatory. So medication, celecoxib, inhibits the enzyme that converts arachidonic acid into something called prostaglandin E2, an inflammatory chemical. If you eat less beef, lamb, pork, dairy, egg yolks, shellfish, you have less raw material to make this inflammatory chemical. And we can also use natural substances to get a similar effect. Curcumin is one of the natural substances that works on an enzyme. Okay, here's a case study that involves inflammation and depression. This patient came to me with a laundry list of symptoms. When she contacted me on the phone, first thing she told me is she had hypoglycemia, but she had a lot more than hypoglycemia. She had lifelong hypoglycemia, she had polycystic ovary syndrome, premenstrual dysphoric disorder, allergies, gastroesophageal reflux, breast thyroid and ovarian cysts, fatigue, stress, diarrhea, belching and gas, abdominal pain, bloating, constipation, heartburn, hair loss, brittle nails, inability to lose weight, carbohydrate cravings, excessive hunger, headaches, dizziness, confusion, mood swings, anxiety, depression, poor memory, sinus congestion, rapid heartbeat, joint pain, menstrual cramps, irregular periods, facial hair, acne. She was on all these medications: metformin, spironolactone, Prozac, there's the selective serotonin reuptake inhibitor, Prilosec, Gliadin, orthotricycline, Flonase. Some of those Flonase, I believe, contains steroids. Steroids are among a number of groups of medications that could contribute to depression. These are some of her lab test results. When I send people for blood tests, I take their results and plug them into a computer program. The computer has two sets of reference ranges, the laboratory range and the more optimal healthy range. We pick up more subtle problems. So you see there's just a couple of abnormalities according to the laboratory, but there are quite a few other areas that are of significance. I'll point out just a couple of these. Vitamin D was below optimal. We saw before vitamin D deficiency could contribute to depression. Triglycerides were above optimal. That's a sign of insulin resistance in many cases. Magnesium is below optimal. That may contribute to depression. Homocysteine was below optimal. That could be an indicator of toxicity. Two big abnormalities were cardio-CRP and the immunoglobulin A. Cardio-CRP shows us there's significant inflammation. Immunoglobulin A shows that there's reduced protection from foreign invaders like infectious bacteria, viruses, and even food antigens. I put her on a program while we were waiting for more test results. We didn't even need the additional test results. She did so well after a month. The program included an anti-inflammatory elimination diet, a medical food for reducing inflammation, Ultra-Inflamex Plus 360, Insulase, which helps the insulin to work better, Biodemulsion Forte, vitamin D supplement, EPA DHA 720, it's a fish oil supplement, selenium, exercise. Elimination diet removes the common allergenic foods. And after a week, she had tremendous improvement. Some of these things I didn't learn about at the 4-week follow-up. I have question marks next to them. But everything else was either no longer an issue or it was improved. There goes the depression. Just an amazing response in a short period of time. This is a very interesting concept. Maybe we give this long involved title and explain this to you. The gut-brain barrier in major depression. Intestinal mucosal dysfunction with an increased translocation of LPS from gram-negative enterobacteria, leaky gut, plays a role in the inflammatory pathophysiology of depression. This study is telling us that in some people there's a connection between depression being caused by inflammation that's the result of bacterial toxins passing through a leaky intestinal barrier into the bloodstream. So there's a number of important parts to this. Maybe the most important is the leaky gut syndrome. What goes on in your intestinal tract can have a strong effect on your brain. If you have inflammation emanating from your intestinal tract, it can wind up causing depression. The results show that intestinal mucosal dysfunction characterized by an increased translocation of gram-negative bacteria, leaky gut, plays a role in the inflammatory pathophysiology of depression. Here's some other studies showing us that supplementing with good bacteria can improve mood. Gastrointestinal tract is important for your health in so many ways, and this certainly applies to depression. Gastrointestinal tract is really the site of main interaction between the individual and the environment. Gastrointestinal tract contains all the same neurotransmitters that are found in the brain, has a vast nervous system on par with the spinal cord, and is directly wired to the brain. Obviously, it's responsible for digestion, absorption of food, used for growth, energy, and repair. As I mentioned, it's the main site of interaction between the individual and the environment. It's home to hundreds of trillions of organisms, some good, others not so good for us, and therefore it makes sense that it's the location of most of the immune system. If you have an immune system problem of any type, including weakened immune system, chronic infections, allergy, autoimmunity, you have to consider what's going on where your immune system is centered, your intestinal tract. And in general terms, this usually involves an imbalance in the types of organisms that are living in your intestinal tract and your tolerance of different foods that you're eating. This represents the single layer of cells that lines the intestinal tract. These are microscopic. This is where the food is and the 100 trillion bacteria. Think of this as a bloodstream. These are healthy junctions between the cell. These finger-like projections called villi increase the surface area for absorption of nutrients. The intestinal lining has to serve two important functions. It has to absorb nutrients for you to produce energy and repair your tissues, and it has to keep bad things out of your bloodstream. It has to act as a barrier. If the bacteria in your intestinal tract had ready access to your bloodstream, it would kill you. So the intestinal barrier has to keep bad things out and at the same time allow for absorption of nutrients. When things are working well, we have the small, properly digested food particles absorbed into the bloodstream. Large, undigested food particles, bacterial debris, toxins are kept out. Now, with leaky gut syndrome, there's a breakdown in that barrier, and you wind up with large, undigested food particles leaking into your bloodstream. Bacterial debris leaking into your bloodstream. These things set off the immune system and poison your body. And that study we saw a few minutes ago with a long scientific title talked about depression resulting from bacterial debris leaking through the intestine and causing inflammation. And there are many things that contribute to leaky gut syndrome. There's specialized testing to identify this. You want to deal with underlying causes like food sensitivities, bacterial debris, bacterial infections in the intestinal tract, medications you're using, stress. Deal with all the underlying causes and take the nutrients to help heal the leaky gut. This is an actual yeast, candida, passing through a leaky gut. That's going to activate the immune system and cause a lot of inflammation. The endocrine system is a series of glands that secrete hormones that affect other functions in the body. Thyroid is one of the culprits in depression, and the thyroid is very sensitive to environmental chemicals. Here's a quote from the Environmental Protection Agency. Typically, hypothyroidism is the consequence of exposure to environmental chemicals. There are many things that may contribute to low thyroid function. If your body is too acid, if you have iodine deficiency, if you have toxicity from fluoride, chlorine, bromine, mercury, you have selenium deficiency, gluten sensitivity, pesticide and other chemical exposure. Too much stress can impair your thyroid hormone activity, altered liver and kidney function, too much estrogen, and various nutrient deficiencies. These are just some of the things that can result in low thyroid function, which is very much underdiagnosed. And low thyroid function can be the cause of your depression. And that was the case for this patient. On blood testing, she had low levels of thyroid hormones. And we put her on some supplements to improve her thyroid activity. And she had an improvement in her mood and other symptoms of low thyroid. And she got off these supplements pretty quickly, and her thyroid function continued to be normal on follow-up testing. And lastly, we'll touch a little bit on food intolerance. This can be a big factor. It's an epidemic of gluten sensitivity nowadays. I test all my patients with gluten sensitivity, and if we don't pick it up with the routine testing, often we'll pick it up with more specialized tests. Gluten is a protein you find in wheat, rye, barley, oats, spelt, kamut, triticale. Actually, you don't find it naturally in oats, but oats are very commonly contaminated with gluten. You can buy certified gluten-free oats, but if your body genetically has an intolerance to gluten and you consume these grains, it can cause depression and a multitude of other symptoms. Celiac disease is the first condition that is associated with gluten sensitivity. It's an autoimmune condition of the small intestine. That's the definition that's usually applied to celiac disease. Celiac disease is a systemic immune disease that can be associated with gastrointestinal findings, diarrhea, weight loss, abdominal pain, anorexia, lactose intolerance, abdominal distension, and irritability, and or highly variable non-gastrointestinal findings, iron deficiency, anemia, dermatitis herpetiformis, chronic fatigue, joint pain, inflammation, migraines, depression, attention deficit disorder, epilepsy, osteoporosis, osteopenia, infertility and or recurrent fetal loss, vitamin deficiency, short stature, failure to thrive, delayed puberty, dental enamel defects, and autoimmune disorders. Classic celiac disease, characterized by mild to severe gastrointestinal symptoms, is less common than non-classic celiac disease, characterized by absence of gastrointestinal symptoms. And that's not even really a complete list. Gluten sensitivity can contribute to much more than that, but certainly can affect your mood. So to wind up, the etiology of chronic health problems, including depression, need not be a mystery. You don't have to settle for symptom-suppressing therapy. You can look for the underlying causes with specialized testing. My website is drdebay.com. You've probably been there. If not, I suggest you go there and check it out. There's a ton of information. I have newsletters on there, a few recorded webinars. Hopefully I'll be able to add this one to the list. I'll be doing other webinars in the future. And now we'll open it up for questions. If you have any questions, please type them in, and I'll do my best to answer. Okay, I have one to start with. How do you know if St. John's wort or SAMe or some other natural supplement would be best for you? Trial and error? Okay, I assume that was probably asked early on in the presentation. St. John's wort, there's really no way to know except for trial and error. SAMe, you might get some indication with the right type of laboratory testing. Those other factors I talked about, obviously with a good workup, we can figure out what needs to be done. Yeah, that's the approach I advocate. I hope that's obvious to everyone. You want to investigate and see what's the issue in your case. It's different for each person. You don't want to be using your neighbor's treatment. You need to have something personalized for you. With conventional medicine, what we often see is people are trying one medication, doesn't work. They try another one, doesn't work. They try another one, doesn't work. Maybe they'll eventually find something that does work. I heard from a psychiatrist who lectures for drug companies. He lectures for these antidepressant medications. He speaks to other doctors and advocates these medications. He told me there's a dirty little secret, and that these medications don't work for a large number of people. Yeah, I really knew that, but it's just interesting hearing it from the psychiatrist. And he told me that something else I knew, which is that a lot of people taking those medications who don't have a great response have an improvement in their mood when they start taking the active form of folic acid. There's actually a prescription version called Deplin, D-E-P-L-I-N. And if you check out the website on Deplin, I think it's probably just Deplin.com. You can certainly find it with the search. And it talks about the use of Deplin in improving mood. And that active form of folic acid is very important for mood. And I mentioned that early on. Roughly about one out of 3 Americans have difficulty in making that active form of folic acid. By itself, it can improve mood, and there's studies showing that in people who take antidepressant medication, it can improve their response in many cases. I don't recommend the Deplin. I learned that Deplin contains artificial dyes, which is not good for your immune system, not good for your health. So there are natural forms that don't contain artificial dyes. Okay, I think there might be some other questions. Can you have gluten sensitivity if you tested negative for a genetic test for gluten? Good question. I'm not 100% sure about that. I'm going to have to look into that. There's a very good test from Cyrex Laboratories. They measure antibodies against like 15 different fractions of a gluten protein. If you had that test and you had an elevated antibody to any of those proteins, I think that would be a reason to avoid gluten. But I'm going to have to look into that genetic component. I'm not 100% sure about that. Form of creatine monohydrate do you recommend? That's what I recommend is creatine monohydrate. There's some other forms of creatine that are good. I usually just stick with monohydrate. Creatine can be enhanced in its function by taking some other nutrients along with it. Alpha-lipoic acid, maybe magnesium, taurine, whey protein, beta-alanine in some cases. And there are some other forms of creatine that have better results in some studies. I don't know if they're worth the money or not. Some are worthless though, like creatine serum form. That was just a comment in the seminar is fabulous. Thank you very much. Better than something presented from the National Institute of Mental Health to psychiatrists and psychologists. Oh, thank you for that comment. It's very nice to hear. I'll be doing future webinars in the future. Future webinars in the near future, hopefully about a couple of weeks. If you're not on my email newsletter list, you can sign up at my website, and I send out notices for webinars in addition to my monthly newsletter. And I do live seminars for people who are in the area. I have a list of those on the website under the What's New page. Okay, if you have any other questions after the webinar, you could always email me. I think that's about it for what I see right now. Thank you all for attending. I hope it was helpful. And I look forward to next time. Okay, good night, everybody. Take care.